We offer review clinics to patients who have inherited bleeding disorders, and also clinics for patients who are on warfarin therapy. And we offer, for that service, we offer a dosing and advice service. For the haemophilia clinics, really we offer a general review for the patient who has a bleeding disorder.
And how was the service set up? How was the need identified, and how did you come to be here doing it all?
The service was set up around 16 years ago by a consultant who came to the area, who identified that there was a real need for nursing care and an overall service for the patients with haemophilia and bleeding disorders. He came from a very large centre in Wales, and really there was no organised care for the patients with haemophilia. And he approached, obviously, the NHS, local NHS authority at the time, along with the patient group, and identified a need for those patients, and therefore a nurse was employed to try and bridge those needs.
Can you just go through for us what you do? Because I know you're a prescriber as well. As a nurse, what you're doing with these patients, and particularly perhaps bringing in your prescribing skills, because that, for some watching, that might be new to them as well, particularly in this area.
In the review clinics, patients, although they're coming in for a general review of their bleeding disorder, may or may not have bleeding problems even at that time. So I can then assess the problem and prescribe and administer their treatment that they required. From the haemophilia service also, we have, it's a very unpredictable disease, and there can be patients who walk in with a bleeding problem and have to be treated quickly, and therefore I can assess that problem and give them treatment promptly, obviously without requiring any medic input. Also, from a nurse prescribing element in that service, I would actually see any patient who came into hospital, if it's an elective admission, because it's such a rare disease. Many medics and nurses within a specific ward wouldn't know the products to use or the treatment to use. So I would go and advise, and often really just prescribe and actually deliver the treatment to the patient pre-operatively. I can actually, we do have a clinic for minor surgeries as well, that I can assess and give patients treatment prior to any minor surgery. For instance, dental extractions are a minor procedure, but for a haemophiliac it could be major if you don't give them the right treatment. So I can obviously prescribe, and prior to those procedures, to allow the procedure to go ahead safely, and then review the patient afterwards and discharge them home. I prescribe mostly factor concentrates for haemophilia and antifibrinolytic agents to prevent any bleeding episodes, or to provide prompt treatment for bleeding episodes or prevent any bleeding episodes. I also usually prescribe anticoagulants and low molecular weight heparins for people who have had acute thrombotic events or at risk of thrombotic events. And
June Ward is a haemophilia and anticoagulant nurse specialist at Ninewells Hospital. She's also an independent nurse prescriber. When we caught up, I began by asking June to describe the clinics that she runs.
know what to prescribe, although they're not nurse prescribers, and I probably fell into that category. So for many years I would sometimes advise the doctors what to prescribe but not legally be able to do it. However, obviously when you have completed the course and you're legal, you are nervous about prescribing something that you know you've advised for years, and I think that was the level of anxiety that I actually had prescribing products that I've used for many years surprised me. And I think the other challenges are that people expect you as a nurse prescriber to know about all drugs, and you don't. You are competent in the area that you practice, and really just to educate your peers that you cannot prescribe absolutely everything, or you may not be comfortable with doing so if you're not, you don't feel competent in that area.
And just finally, slightly different question, but evaluating your service, is there any ongoing measurement, or are you planning to evaluate? I suppose the question is, how do you know that it works, that it's effective, that everybody's gaining benefit from your service?
From the haemophilia service point of view, we are audited usually triannually by the United Kingdom Haemophilia Centres Directors Organisation, and that means that we are actually physically audited by a physician from another NHS trust. Actually a nurse, and also a nurse representative comes from another NHS trust, and a patient representative is going to be added to that in the next audit round. There's a formal audit tool that a haemophilia centre and service, along with the nursing service, must provide, so that is obviously completed, and a part of that audit tool is a survey to the patients so that they have input into what the service offers and obviously can suggest improvements in the service. So we do that as, we have to comply with that. We do our own selves, usually patient surveys on any service development that we perform. We've recently just completed an annual survey of our patients. Sorry, I've lost the words. The quality of the service, and also we provided a new service for home delivery for patients who are receiving home treatment. So we've obviously inputted and audited that. From the anticoagulant service, we have to meet national guidelines, and there is an audit tool that we use throughout our area to really assess if we are meeting those national targets, and that is in conjunction with our sort of Tayside audit service. So we formally do that. We do a lot of education with our patients within that service, and we've done our own sort of surveys and audit to see that we are actually providing that educational standard.